Evening, good afternoon, and good morning. This is the 1780th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Vaidehi Bhatt. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. We have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have the international session in English. And from 9:30 to 10:30, we have a local language session in Malayalam. We are uploading the videos of the same on the very next day itself so that those who miss the session can watch it again. You can share it with your friends, whether it be a homeopathy lover or a student or a doctor, it doesn't matter. The purpose of this forum is to take homeopathy to every home around the world. And we are getting professionals from 65 countries for presenting papers in this forum, and we are lucky to have such wonderful personal presentations here. And let me come to today's guest. As you all know, today our guest is Dr. Vaidehi K. Bhatt. She has completed MD and is HOD and Professor, Department of Homeopathy Pharmacy, L.R. Shah Homeopathy College, Rajkot, and she is having her own clinic, that is Vaidic Clinic, and she is having wonderful OPD in there. She has a training under famous doctors, and she has given Instagram live sessions on Paul homeopathic portal on topic of PCOD, myth and fact, etc. And she is a resource person in Prasad Bharati, All India Radio, Doordarshan in health program Nirmay on the topic of child obesity and homeopathy on 29th April 23. And she has published, she has many publications and editor of the issue, the title, The Definite Troubles and Guillotine Homeopathic Excellence in 2015. And she has presented some of the best research papers in this research situation. And she had some great achievements on research paper presentation in Aish India Expo 2080 on the topic of management of postpartum depression with the homeopathy under category of mother and child care with homeopathy. She is an international speaker. She always speak about PCOC myths and facts, etc. And as a resource person in All India Radio and live show, she has so many extracurricular activities, many cultural events for students and everything. And the doctor has presented some of the best papers in this forum. And today we'll be talking about healing young minds, homeopathic insight into childhood behavior disorders. It's a wonderful session we are expecting from Dr. Vaidehi Bhatt. We proudly welcome the guest of the day, Dr. Vaidehi Bhatt, to this forum. Welcome, Doctor.
Good evening, one and all present on this day with me. Thank you, Danesh sir, for again introducing me and inviting me for another topic on the same forum. I feel privileged to giving multiple sessions on this forum.
Yes.
Sir, my
Yes.
PPT is visible for everyone.
Yes, it's visible. You can enlarge it. Get a full screen. Greeting
Okay.
from Dr.
Is it okay, sir?
Okay.
Okay. So today's our topic is healing young minds, homeopathic insights into the childhood behavior disorder. So again, we are coming with the psychological topic, but now what is related with the child? So every child is a universe of the potential, and with the help of homeopathy, you can unlock the behavior problems gently, safely, and naturally. So, in today's session, we are going through the multiple phases of this topic. So, childhood is a sensitive and foundation phase of the life when there is the mental, social behavior of the child will develop, and that will resulted into the adult behavior changes. So, in recent decades, there has been a noticeable rise in the behavior issues among the children globally, and it affects the learning, cognitive behavior, relationship, and overall the development. And the modern lifestyle, family dynamics, screen exposure, mobile uses, and some academic pressures, even pressure from the family members and parents contribute significantly to this trend. So, behavior disorder, if it will left untreated or unaddressed at this stage, it will extend into adulthood and creating lifelong challenges. So there is a need for the early intervention with the approaches that are gentle, effective, and individualized. That is our homeopathy, because our system is very holistic in nature. It is safe and it considers child as a whole, and it will treat its his emotional and mental sphere. So, globally, if we consider the prevalence of the childhood behavior disorder, we find the 10 to 20, around 20% cases of the mental and behavior disorders. And if we go through the attention deficit hyperactive disorder, it is approximately 5 to 7% cases in school age children. And autism spectrum disorder, now it is very much common, so we will find the one kid is suffering with it among 100 children worldwide. If we consider the India, ICMR studies shows that around 23% of the children in India shows the signs of the behavior and emotional problems, and ADHD prevalence in Indian school children ranges from 1.6 to 17.9%, and in urban children shows the higher rates of the disorders due to the increased screen time, academic stress, and lifestyle changes. So if we consider the gender, we find the more commonly it will diagnose in case of the boys rather than the girls. And in boys, we find mainly the ADHD crisis and conduct disorder. And emotional disorders like anxiety, depression are more often reported in girls during adolescence, during the starting of the pubertal stage. So at the age around 3 to 7 years, we find the changes of ADHD and this autistic behavior in a kid more commonly, but it diagnosed later due to the lack of awareness. So comorbidity, we find the multiple overloading disorders, and need for early detection is needed because there many cases are go undiagnosed due to the stigma or fear of the parents, what society will tell that your kid is suffering with the psychological troubles and all, and lack of trained professionals are there, and there is the misinterpretation of the symptoms. So now we are going to understand what actually the meaning of the behavior disorders. Behavior disorders refers to persistent pattern of the disruptive, impulsive, aggressive, or socially inappropriate behavior that are not age appropriate and interfere with the normal development. So it consider or covers the area which affect the negatively, like academic performance and learning, family and relationship, social and emotional development, and daily functioning, routine, and even discipline. The kid is not able to understand any of this will having a problem in the perceivance. Then the key characteristic, if we consider frequent temper tantrums, excessive arguing or defense, then hyperactivity, inattention, aggression, lying, stealing, withdrawal, or excessive fear. There are many factors affecting the behavior of the kid, like emotional, related with the grief, any trauma, any anxiety, psychological, developmental delay, personality issues, environmental, that is the dysfunctional family dynamics, bullying or neglectation from the family members, from the friends or the society or near and dear ones, biological, genetic predisposition, neurochemical imbalances. If there will be a continuation of this changes, it will convert into the chronic nature, and that will be a problem development in a case of adulthood also. So what are the common behavior disorders in children? There are many disorders. Some of things we consider repeatedly
Doctor,
and some
Doctor
are
slide,
left.
hello,
Yes, sir.
Doctor
Yes,
slide is not moving. Still, it is on the first.
uh, just a second, sir.
Okay, definition, key characteristic.
Sir, now it is visible?
Yes, now it is visible. Definition onwards. Yeah, which way?
Or after that underlying factor?
Now after impact area, then my key characteristics. You want to go
Then
to
I
the
have
next
changed
page?
the slide to underlying factors and chronic nature.
No, no. You may go to the next page.
Just a
Now,
second, sir.
now it is
Start it
correct.
again.
That is underlying that. Yes, first page.
Sir, it is visible?
Yes, yes, yes. Now you.
Okay. So
No,
we are
no,
at
no.
the definition.
Now you may go to the. It is stuck again. First page itself. You may go to the third page, I think. Go downwards. Now introduction. Next page. Next page. Global understanding behavior disease. Next page. Impact. Next page. Next page.
Definition.
My definition impact. Then key characteristic.
Epidemiology.
Next page is the page to be discussed. Now epidemiology. Yes, from here you can go.
Okay, sir. So I can start with the epidemiology. Okay, sir. So if we consider, sir, it is visible now?
It is visible.
Okay, sir. Thank you, sir. So, if we consider the global prevalence, around 10 to 20% of the children and adolescents worldwide experience these mental behavior disorder, and approximately 5 to 7% of school age children globally are affected with the attention seeking hyperactive disorder. And as we consider the autism, nowadays it is very much common, and we find the one case in 100 children worldwide. If we consider the Indian specific data, so I saw a research showing that around 23% of children in India shows the signs of behavior or emotional problems, and ADHD prevalence is around 1.6 to 17.9%, and urban children shows the high rates rather than the rural children, and it is due to the increase in screen time and academic stress and lifestyle changes. Now the gender disparity. So behavior disorders are more commonly diagnosed in boys than girls, especially the ADHD and conduct disorders. And emotional disorders like anxiety, depression are more often reported in girls during adolescence at the starting phase of puberty. Then it will start around the age between 3 to 7 years, but it will diagnose late due to the lack of awareness. We will find the multiple overlapping disorder in a kid, and we need to diagnose it early because many cases are undiagnosed due to the social stigma, lack of trained professionals, or misinterpretation of the symptoms. Understanding the behavior disorders. Definitions. So, behavior disorders refers to the persistent pattern of disruptive, impulsive, aggressive, or socially inappropriate behavior that are not age related, appropriate, and interfere with the normal development. So many areas are negatively affected due to this behavior pattern, that are academic performances and learning, family and peer relationship, social and emotional development, and daily functioning and discipline. So there are some characteristic features: frequent temper tantrums, excessive arguing or defense, then the hyperactivity and inattention, aggression, lying, stealing, withdrawal, or excessive fear. Then various underlying factors are responsible for development of this behavior disorder. Majorly it is associated with the emotional sphere, that are unresolved grief, trauma, anxiety, psychological, developmental delays, personality issues, environmental, that is the dysfunctional family dynamics, bullying, neglectation, genetic predisposition, neurochemical imbalances. And if won't treated this behavior disorder at this stage, that will develop into the chronic nature and can progress into adulthood, leading to more severe mental health conditions. So some common behavior disorders in the children. Sir, it is visible, na? Hello? Hello?
You may please still stuck. Next, go to next page. Visible, but
Sir, common behavior disorders is there now?
epidemiology first page is still there. You
Yeah,
may
sir,
go to
it
the,
is.
just click to the second stage. Now common behavioral disorders in children.
Yes. Okay.
Okay.
So, common behavior disorders, attention deficit hyperactive disorder, that is ADHD, that is characterized by the inattention, impulsivity, and hyperactivity, and child may struggle with the focus to sit still or complete the tasks. Then the oppositional deficit disorder, marked by the frequent deficiency, hostility, and argumentative behavior towards the authority. There may be a deliberate annoying or blame others for the mistakes. Then conduct disorders involves the serious violations of the social rules, like the aggression, bullying, lying, cruelty towards the animals, and it can lead to the legal or criminal issues if untreated. Then the autism spectrum disorders, a neurodevelopmental condition with impaired social interaction, restricted interests, and repetitive behaviors, and it varies in the severity and presentation. Then the anxiety disorders includes separation anxiety, social anxiety, and generalized anxiety.
Let's go to the
Children,
next page. Next page. Next page. Still stuck. Just click.
it's coming late actually.
No, it is still. Your network is a little bit slow, I think. Maybe. Now just click again.
Sir, anxiety disorders?
No, the disorder. Last part is still. Last page is still remaining.
Okay, sorry for the inconvenience faced by you all. Next, anxiety disorder includes the separation anxiety, social anxiety, and generalized anxiety. And children may exhibit the excessive worry, fear, and avoidance behavior. Then the depressive disorder, that persistent sadness, irritability, low self-esteem, and low interest in the activity, and it also includes the sleep and appetite changes and academic decline. Then the learning disabilities, that is difficulty in the reading, writing, or mathematics, despite of normal intelligence. So often it leads to frustration, low confidence, and behavior issues. Then the obsessive compulsive disorder, OCD, presence of repetitive thoughts and ritualistic behaviors, that is the compulsion to do certain activities. Then child may feel compelled to follow strict routines. Then tic disorders, it involves the sudden repetitive movements of the sounds, and then the it may be a motor, that is the blinking of the eyes or grimacing or vocal grunting or throat clearing. Then what are the causes and contributory factors? Now it is fine now, sir? Causes and contributory factors. Then I can move further.
Please go to the next page.
Causes and contributory factors.
Okay,
Is
okay.
this visible?
Yes,
Yeah.
yes.
Yes, sir. Okay. Then the biological factors, that is the genetic predisposition. If someone having a family history of the mental health disorder, then the neurodevelopmental issues like developmental problem in a brain structure, functions, then the chemical imbalances, especially in neurotransmitters like the dopamine and serotonin secretion, then the prenatal and perinatal factors. So maternal substance abuse or malnutrition or stress during the pregnancy will lead to problem in a behavior problem in a kid. Certain birth complications like the prematurity and low birth weight and certain delayed developmental milestones or neurological damages are there. Then the psychological factors, trauma, that is the abuse, neglect, or loss of a parent. Then the low self-esteem, emotional insecurity, or the unresolved inner conflicts, poor coping mechanism in the stressful situations. Then the environmental and family factors like dysfunctional family environment, violence, separation, instability, then overprotective or neglectful parenting, then lack of boundaries or inconsistent discipline, poor role in modeling by the adults or siblings. Then certain social or academic pressures are there, bullying or peer pressure at the school, then the unrealistic academic expectation by the parents or teachers, or learning difficulties, then the isolation and inability to perform the friendships. Then certain lifestyle and technological factors are also contributing in behavior disorders like excessive screen time, video games, social media exposure, then poor hygiene and erratic routines, then lack of physical activity.
Let's go to the next page. Lifestyle tech, social academic pressure. Okay.
Sir, when I'm going for a full screen now, it will stick. So can I go with this? It can be visible?
Yes, sir. Yes,
Okay,
now
sir.
it is visible.
Okay, sir. So, certain lifestyle and technological factors like excessive screen time, video games, and social media exposure, poor sleep hygiene and erectile routines, and lack of physical activity and exposure to nature. Nutritional and medical issues. So, deficiency of the essential nutrients like iron, omega 3 fatty acid, zinc, vitamin B12. Then, food allergies or sensitivity like certain allergies related with the artificial flavor, artificial colors, sugars, chronic illness affecting mood and behavior. So let's move ahead with the homeopathic approach of this condition. Holistic and individualistic approach of homeopathy. So in homeopathy, we consider every child as a unique individual rather than a diagnosis or labeling her or him with certain disease condition. So it does not follow a one size fits all model. Instead, the treatment is based on the totality of the symptom. So in our approach, we consider the mental state, that is a consideration of the fear, emotions, coping mechanisms, then physical symptoms like appetite, sleep, energy levels, routine physical generals, then the behavior patterns like reactions towards the environment, family, and stress. Then the remedy selection is based on the understanding of the child's complete constitution, personality traits, past life, and family tendencies. So, our goal is not only to suppress the symptoms but to stimulate the body's own healing ability and bring about balance at all levels. So, we believe in our mind body connections. So, in homeopathy, mind and body are seen as a unified whole. So, it is not a separate entities. So, in children, mental and emotional states are considered just as important as physical symptoms. So, certain behavior disorders often reflect inner emotional imbalances such as suppressed anger, anxiety, grief, insecurity, or fear, then lack of emotional expression, unmet needs. As for example, a child who shows the aggressions may embody insecure or craving attention, and the child is hyperactive, might be mentally overstimulated or emotionally unsettled. So in homeopathy, medicines are chosen to address the both mental and physical layers. So our aim is to treat them deep rootedly, and that's why our approach is like emotional stability, cognitive focus, and physical health all in one harmonious conditions. So, if we consider the organon of medicinal approach in case of behavior disorder in kid, we have a specific guideline given by the masters in a various aphorisms in the six editions. Like aphorism 1 is related with the physician's mission. So here in case of children, behavior disorder is the goal is not to suppress behavior but to remove the internal derangement causing them. So maybe it will be a emotional, miasmatic, or energetic. Aphorism 5, role of causation and individualization. So we have to look the psychological causations like fear, jealousy, neglect, parental conflict, early winning, or vaccination trauma, and identify the miasmatic inheritance and consider the individual traits, not the diagnosis like ADHD and autism. Then we consider the totality of the symptoms. Aphorism 6 says that observe what is strange, what is rare, what is peculiar. Use the non-verbal clues like the expression, play behavior, drawing, sleep patterns. The totality must include the matter mental symptoms, emotional reactions, physical generals, behavior peculiarities. In aphorism 8, internal dynamics. where the behavior disorders are not the structural and physical disease alone. They are energetic disturbances of the child's vital force, and often it will be manifested early in life. So, aim of homeopathy is to correct the imbalance by the energetically similar remedies. Aphorism 18 and 19, it is related with the deeper separation, miasmatic flare up, and loss of individuality used by the other system of medicine and creating the artificial disease in the kid. So, homeopathy respects the child's inner nature and guides the healing through a similimum. Then aphorism 23 to 26, similar remedy heals. So, if when the child is disordered, state is matched with a homeopathic remedy, the vital force shift towards the balance. That will lead to the emotional, mental, and physical improvement. Then aphorism 155, individual inner prescribing. So it is very peculiar symptoms like the leaking windows or fear of faints or desire wear only red clothes. So this becomes the keynote of the remedy selection. So avoid generalization related with the name of the disease and common rubrics unless the we find the clearly qualified peculiar features to give a similimum to the kid. Then aphorism 211 to 213, mental emotional disorders. So in this case, observe the fear, clinginess, obstinacy, reactions to praise, scolding, sleep behavior. The mental picture is often more prominent than the physical symptoms. Then aphorism 228, avoiding suppressive measures. So modern behavior treatments with the suppressive drug can aggravate the internal disorder, as Dr. Hanuman advises us to give a gentle cure through the natural law, that is similimum. Aphorism 275, potency and repetition. So for this we have to observe a long follow-up, especially in a children, due where the vital force is dynamic and impressible. So repetition only when the relapse is evident or new symptoms will arise. So these are the guidelines given by our master in organon regarding the mental disorders. Then, what are the miasmatic influences or hereditary tendencies related with the miasm? So, in this chronic predisposition manifest as recurrent infections, allergies, emotional instability, fears, behavior abnormalities, and developmental delays. So if we consider it in our four miasms, in case of Sora, there is insecurity, fearfulness, and inferiority complex. In psychotic, obsessiveness, impulsiveness, and secretive behaviors. In case of syphilis, destructive tendencies, aggressions, and violent outbreaks. In case of tubercular miasm, there is restlessness, disobedience, craving for change, and excitement. So, miasmatic influences in children with behavior disorder often show mixed miasmatic traits, influencing the remedy selection. So, certain hereditary tendencies plays a crucial role in selection of the medicine, like family history of the mental illness, addiction, neurological issues increases the child's susceptibility. So, our aim is to break the inherited pattern and strengthen the child constitutionally. So, considering miasm in case of analysis allows due to deep cure, prevention of the recurrence, and strengthening of the vital force. Then, the observation plays a vital role in a selection of the homeopathic medicine. So, in homeopathy, prime importance is given on the individual, peculiar, and characteristic symptom rather than the common signs of the disorder. And children behavior observation is key to understanding the inner state, especially when it cannot be expressed by themselves clearly. So peculiar symptoms can help the differentiate one children from another, even if they have some diagnosis, same diagnosis like ADHD and autism. So, what are the important aspects to observe? First of all, fear of dark, animals, strangers, being alone, etc. Like dreams, repetitive themes of falling, monsters, running, then habits, nail biting, thumb sucking, hat twisting, then reactions to the reprompt praise, change in the routine, then the interactions with the parents, siblings, peers, teachers, then behavior triggers, what version or what calms the child. As for example, if two kids are having a hyperactivity and one having a restlessness, music sensitivity and impulsive behavior, and she or he may require tarantula hispanica, and another having a irritability, worm infestation, dislikes to be being touched, and they required Sina. So this peculiarities form a core of the totality on which the simillimum is selected. So remedy selection is not depend on the disease condition. It depends on the totality of the patient, on the mental symptoms, on the physical tendencies and behavior traits. So in case taking of the children, we include the certain points specifically due to the pediatric age. First of all, observation based approach. Carefully observe the children, their expression, their gesture, their body language, their play pattern, interaction with the toys, reactions, non-verbal signs are more prevalent than the detailed parental inputs like birth history, developmental patterns, behavior at home versus outside, triggers and coping mechanism, and importance of the understanding of the family dynamics, sibling relationship and parenting style. Then mental and emotional sphere focus on the fears, anxieties, jealousy, anger, shyness, obstinacy, sleep patterns, dreams, reaction to discipline or affections. Then take a physical journal and personal history like appetite, thirst, food preferences, bowel habits, thermals, perspiration, any past illnesses there, vaccination history, recurrent complaints like cough, allergy, constipation. Then observe the constitutional and miasmatic analysis can be done on the base of it, like identify the child's constitution and any hereditary tendencies or chronic patterns to catch the infections or behavior traits are running in the family, we have to note down it. So goal of the case taking is to find out the simillimum in case of homeopathy. So we treat a totality, observe peculiarities, recognizing miasmatic influences, use minimum doses and prefer dynamic healing, and be an unprejudiced observer. If we consider GNM theory in case of behavior disorders, so GNM is related with the biological conflict or shock. That is a highly acute or isolating emotional event that catches the individual by surprise. So this shock lead to a biological adaptation program in the brain and body, and in children this often expresses as behavior or developmental changes. So in brain organ site connection in GNM, each behavior symptoms is linked to the type of emotional conflict, relay center in the brain, and functional or behavior adaptation of a kid. So certain causes of the behavior disorder in children are, first of all, intrauterine or early childhood conflicts, that is related with the mother's conflict during pregnancy, birth trauma, separation shock, sudden weaning or hospitalization. So certain conflict themes are there related with the GNM, that is the theoretical fear conflict, motor conflict, self-deprivation conflict, separation conflict, speech conflict, and existence conflict. And that will lead to the certain behavior changes in a kid like restlessness, hyperactivity, poor learning, clinging, emotional withdrawal, delaying in a speech and silence. Then the child exhibits the anxiety and over attachment. In case of attention seeking hyperactive disorder, it is related with the motor conflict, that child feels trapped or unable to act freely. So theoretical fear in case of kid is losing a safe place. Or if we consider the mother's conflict in that, I am struck or I can't move, project onto the fetus, and this will lead to a trap filling in a kid. So brain relay this information through the motor cortex and cerebral cortex to kid, and this will increase the movement, the helps child related with the survival by acting out danger. Then the autism or autism spectrum traits by the GNM. It represents the multiple stimulation conflict shocks in the uterus. So separation conflict, detachment and resistance to bonding, communication conflicts, that is the silence and repetitive language, self devaluation, that is the withdrawal or obsessive behavior, sensory overreactivation like adaptation to the hyperalert brain function, and biological interpretation to protect self. Child retreats from the overwhelming stimuli or unresolved conflict. Then healing in case of GNM, real healing begins only when the conflict is fully resolved. So healing support plan is like the identify the original conflict area or original shock in case of mother and children history. Then they help the child feel safe and seen and connected with the environment, with the family, with the parent, with the friends. Support parents to release the guilt over control, separation, fear, and avoid re-traumatizing the child with aggressive behavior reactions. If we consider this in a repertorial point of view, there are many rubrics and many medicines in Kent's repertory, Murphy repertory, complete repertory, and synthesis strategy addition. So we consider Kent repertory for the classical mental rubrics, Murphy for the clinical rubrics, complete for the modern or lesser known remedies, and synthesis to include the batch flower remedies and real mental states. So certain rubrics are there related with the hyperactivity and restlessness, like mind restlessness in children in mind activity increase, mind impulse to run to jump. Various medicines are there in case of this rubric. Then temper tantrums and aggressions, mind anger children in, mind striking children in. Then the mild rage fury, mind obstinate children in. Then emotional sensitivity, easily hurt rubrics, mind sensitive reapproaches to, mind whipping easily, mind elements from screen being, mind yielding disposition. Then fear, anxiety, insecurity rubrics, mind fear alone of being, mind concentration problems and attention deficit disorder ADHD, mind concentration difficult, mind thoughts vanishing, mind thoughts vanishing, then the mind memory weak, then repetitive behavior like mind repetition of the word sections, mind silence, then mind indifference, mind fixed ideas, then jealousy, mind delusions, mind hatred, then the manipulative or attention seeking behavior, mind desire, deceitful, mind cunning, mind protecting to be sick, mind crying. Rubrics: mind deceitful, mind cunning, mind pretending, mind crying. Then poor social interaction, mind aversion, mind timidity, mind delusions. Then intellectual delay, mind imbecility, mind dullness, mild mistakes. So various rubrics are there having multiple or various or many medicines. So if we go through the materia medica, Anholinum, it is for the visual hallucination, dreams like a state, detachment from the surrounding. In Ethusa, difficulty with comprehension, mental confusion, intolerance of milk and restlessness. And Cypripidum, nervous excitement in children, hyperactive, restless sleep, irritable teething. Buforana, dullness, sexual precocity in children. Then Veratrum viridi, sudden mood swing, violent temper, impulsive. Haliburus niger, mental dullness, slow response, leg caninum, alternating behavior, jealousy, inferiority complex, extreme emotional swings, umbra gracia, extreme shyness, stage fright, anxiety in public, difficulty in expressing thoughts. In case of opium, indifference, unresponsiveness, sluggish mental activity after fright or trauma. In circuitalia, nervous irritability, twitching, and sensory overload. Then, frequently using medicine, Tarantula hispanica, extreme restlessness, rapid movements, loves music, mischievous, impulsive. Viratramal, maniacal behavior, overactivity, destructiveness, hyperverbal. Then the zincum metallicum, constant foot movement, nervous fidgetity, delayed speech, mental dullness. Hyoscymos, loquacious, foolish laughter, inappropriate behavior, jealousy. Sina, irritability, does not want to be touched, grinding of the teeth, and worm infestation. Stramonium, violent behavior, fear of dark, night terror, sudden aggression. Tuberculinum, there is the craving to change, highly energetic but rebellious. Carcinosis, sensitive, artistic, perfectionist, fastidious. May have family history of the cancer and suppression. Baraitaka, shyness, mentally underdeveloped, delayed milestone, dependent, poor social interactions. Thuja, fixed ideas, introverted, talks to imaginary friends, history of vaccination reactions. Then crocus sativus, sudden mood swings, cheerful, then crying, impulsive, affectionate, and jerky movements. Agaricus muscaris, twitching, jerking, unconditional movements, giggles without the reason. Lac felinum, sharp intellect with low self-esteem, intense sensitivity, poor boundaries. Then sacrum officinalis, craving for the sweets, feels unloved, attention seeking, irritable when restricted. Madorina, extreme behaviors, love thrill, disobedience, hypersexuality in children and early maturity. Then the Senecula equa. They are stubborn kids, fuzzy children, loves to argue, craving for indigestible things and erratic habits. Lec maternum, children with the attachment issues, insecure about bonding, highly sensitive emotionally and physically. Cannabis indica, disconnected from the reality, detachment, imaginative fears, out of body experience, feeling. Semisifuga, constant talking, mood swings, sensitive to weather, fear, depression, excitement, alternating. Then the peonia, useful in restlessness and irritable kid. Platina, arrogance with aloofness, children feel superior, contemptuous, touchy, and isolation tendency. Muscus, overreactivity, fainting tendency, nervous spasm, and theoretical hysterical behavior. Staphysagria, suppress anger, sensitivity in a children who tolerate abuse, but explode later. Then the magnetic polus australis. Medicine belongs to imponderabilia. Children with the extreme restlessness with alternating moods, magnetic sensitivity feel out of place. Then bambusa, useful in the delayed development, joint pain in growing children, and emotional immaturity. Then the falcoparaginus, for the children who extremes and dominance versus submissions, control issues and identity confusions. Chocolate, mood upliftment, issues with the emotional nourishment, reward seeking, and instant gratification tendencies. Sacramenticus, filling of the deprivation, sweetness seeking, and inner emptiness marks with the charm. Then the falcon, mental alertness, fear of losing control, strong insight in the children who feel spiritually misunderstood. Calcarea carp, slow in comprehension, fearful, clumsy, sensitive to catch cold, and loves routine. Buforana, mental dullness, sexualized behavior in young children, and delayed development. Certain biochemical remedies will be indicated like Kali force, Calcarea force, Mac force, Ferrum force, Silicia. In case of Kali, in case of nervous impairment, nerve exhaustion, Calcarea in case of developmental delay, Mac force in case of spasmodic pains or tantrums or oversensitivity, Ferrum in inflammation and weakness, Silicia in lack of confidence, timidity, and slow development. Oftenly, in case of ADHD or school stress or concentration issues, we are indicating Kali force and Calcarea force in a biochemic combination. The uncertain Bach flower remedy. Bach is known for the emotional things only. So over here also we consider the Bach flower remedies. First is the empathiness, restlessness, impatience, hyperactivity. Cherry plum for the loss of control. Rescue remedy for the acute stress, panic attack, or calming situation. Heather, excessive talking, attention seeking, or clinginess. Crab apple related with the OCD, obsessive behavior, hygienic fixation, and self disgust. Walnut, difficulty and adapting in changes, transitions, school fears. Then larch, low confidence, fear of failure. Then chicory, possessiveness, manipulative emotional demands. Then wolverine, over enthusiasm, then hyperactivity and strong options and excessive energy. Certain mother tinctures can be supportive in a treatment like passiflora for calming the mind. It is natural sedative. Then the Valeriana officinalis, it acts as a nerve tonic. It reduces nervousness, irritability, and restlessness. Avena sativa is a general nerve tonic in case of ADHD, which improves the mental clarity. Then secretaria related with the nervous irritability and reduce the twitching and hyper reflexes in limbs. Then the Vaithania adapted to the control over the stress and improves the emotional resilience. Then the Brahmi enhances cognitive functions, memory, and learning ability. Gelsemium for the anxiety before performance and to reduce the fear of failure. If we consider or connected GNM with the homeopathy, so biological conflict is related with the dynamic healing. So here we consider the GNM, various GNM conflict theme, which reflect in a child's behavior, and many suggested remedy related with this conflict, like theoretical fear conflict, that is the fear of threat in personal space. Having issues with the child and mother, reflected as a restlessness, hyperactiveness, or clinging behavior. Motor conflict, feeling trapped or unable to move, having a hyperactivity, constant movement, and clumsiness. Separation conflict, fear of being separated from loved one, real or maybe symbolic, related with the clinginess, detachment, crying when left alone, or aversion to touch. Self-devaluation conflict, I am not good enough or I can't do it, lead to poor confidence or school refusal. Speech conflict, inability to speak out, delayed in the speech, mutism, stammering. Existence conflict, related with the fear of survival. Usually it is related with the mother during pregnancy. And disposition, having anxiety, fear of dark, and panic when alone. Heart conflict or shock, intense emotional shock, sudden withdrawal, and emotional numbness. Then identity conflict, unclear role in a family, school, and body, gender confusion, behavior switching, or poor self image. Then hanging conflict, repetitive behavior, compulsions lead to rituals, autism trait, fixed fear, OCD like tendencies, and various medicines are there related with this conflict. So certain non-medicinal supportive measures we have to take to support the children, because homeopathy works best when it is supported with the structural routine, emotional support, and developmental interventions. So certain children issues need a stable environment, consistent support system for holistic healing, like structured routine, set a fixed timetable or schedules for them, positive reinforcements, praise them, reward them with their desirable behavior, calming technique, that is the yoga, breathing, exercise, guiding relaxation, expressive therapy like art, music, dance, or drama therapy, special education supports like remedial teaching, individualized learning plans, and counseling. Then the parent counseling, that is educate parents about the understanding of child's unique need, avoidance of punishment based on the discipline, handling emotional triggers, and limit screen time, which is more needed nowadays, which reduces the irritability, poor sleep, and reduce focus. Offline activity can be promoted, interactive playing can be done. Outdoor activities with the nature, exercise, sunlight improves the mood and behavior of the kid.
Okay, madam, it's already our time is over. We can have another session with your cases. So then it will
Okay,
be,
sir.
if you are willing, we can do it on 19th. So
Okay, sir.
the
Jeez.
19th, is it possible?
19th. Okay, sir.
And okay. Okay, then on that 19, we can make the second part. Already the time is over. That's the reason. Anyway, it's just
It's
really a
okay.
very, very good session. And you really covered almost all part of this session. And I am inviting Dr. Manoj to say a vote of thanks to the session.
It's nice presentation, especially this is a disease of the era, the contemporary disease, most important on the new generation must be it is structured or modified in according to with our medicine. So on behalf of IFPH, I'm expressing sincere thanks to Dr. Vaidehi and all those participated session. Thank you.
Thank you, Dr. Manoj, Dr. Vaidehi Bhatt, and those who attend the session. Since there is no time remaining today, we have another session coming. We can have the second part of the same on the 19th itself, so that we can have a discussion at that day also. So hope all of you will be joining on the session tomorrow also. Tomorrow we will have a session from Professor Dr. Biphu Pandey. Sir is presenting homeopathy and women's health, hormonal balance from puberty to menopause. That will be another big session for tomorrow. Hope all of you will be. Thank you once again.
Thank you, sir.
It's over to Dr. Mariamma John to moderate the Malayalam session.